Part 2, personnel radiation protection.
You mind if I move your stand a little bit over?
Oh, yeah.
Thank you.
Which one? I think this is my better side.
What? They're both good sides.
All right. So what we're going to be talking about here is ALARA. Okay, ALARA is a concept that we practice day in and day out as the basics in radiation protection. And what it stands for is as low as reasonably allowable. So what we're trying to do here is, in our profession, we're trying to create radiologic images for proper diagnosis of our patient. In doing so, we also want to minimize the amount of radiation as low as possible in obtaining those quality radiographs. So what we do here is we follow the linear non-threshold graph as we talked about, and assumes that there is no minimum threshold to cause some sort of biological effect. Now, if you think about this in the bigger picture, if we are minimizing the amount of radiation that our patients are receiving, are we not also minimizing the amount of radiation that we are receiving? Okay? So this is where ALARA falls in, as low as reasonably achievable or allowable. The greatest threat for operator exposure comes from scattered radiation. Scattered radiation is not only bad for the image, in which it causes unwanted density, there's a loss of contrast, there's a loss of resolution. You all remember that, right? But scattered radiation is also bad for whoever's within the exposure environment, because scattered radiation coming from the patient and also coming from the equipment doesn't have the same intensity as primary radiation. Secondary radiation is going to be a lot weaker, and when it interacts with another object, most of that energy is going to be absorbed, causing biological effects. Okay? So if we're not in the room, we need to be outside of the room or somewhere away from the source. So the operator must stand in a controlled area behind a protective barrier away from the source and also away from the object, in this case the patient being irradiated. When we're stepping out of the room, there also has to be a window. We'll talk about this later on, because we are leaving the procedural environment. We still need a way to communicate and maintain the line of communication with our patients so they are not hurt when we're not looking. Other provisions must be provided to maintain a line of communication. We'll talk about that here in just a bit. All right, so let's talk about personnel protective accessories. If the operator is required to remain in the exam room during exposure, he or she must stand as far as practicable away from the scattered radiation source. When we are in an exam room, the minimum distance from both the source of radiation, when I'm saying source of the radiation, what am I talking about?
X-ray tube.
X-ray tube, right? So you need to be at least 6 feet away from the X-ray tube. You also need to be approximately 6 feet away from your patient. Okay? Because there's two sources now. You got it from the X-ray tube, and you also got a source coming from the patient. So if you're standing at least 6 feet away, you're in pretty much good shape. Okay? And you can additionally protect yourself by wearing some type of protective apparel. All right? We're also going to be using a personnel monitoring device. It's just basically a monitoring badge that you wear on your collar.
It measures like radiation?
It measures the amount of radiation, because we need to keep track of the amount of radiation that you're receiving during your employment.
So is it like a Geiger counter? Or is it...
It's not a Geiger counter. There are different types. Okay, one of them is a Geiger counter type that we'll talk about here in just a little bit. Okay, so there are various types of monitoring badges that we'll talk about here in just a moment. But this is to measure not only the type of radiation that you're getting, the quality, but also the amount. As radiation workers, we are allowed a certain amount of radiation per month, per quarter, per year. And as long as we stay within that threshold, we're okay. Okay? See, again, we have a threshold, but we practice it as if no matter how small, there's going to be an effect. Yes?
So what happens if you're halfway through the month and you're past your threshold?
You're retiring.
Permanently.
They get rid of you or they
What they're gonna do is they're gonna keep you under observation, make sure that there isn't any type of biological effects. And the thing is, with the amount of radiation that you're getting, the effects may not be immediate. So we need to figure out first, was this erroneous? Okay, because that happens all the time. When you have a reading that's exceeding the level, we're gonna do a little investigation. And it's usually just because you left your badge in the car. Or it's because you left your badge in the procedural room. Okay? It's usually not because of some stupid thing you did in the department.
So it's picking up like other types of radiation.
Exactly. Okay? But if you do exceed that, then again you're gonna be on temporary leave. Okay, I mean you'll probably still be working, but not in a procedural room, and we need to do an investigation. And the effects, again, will not be immediate because the doses that we're getting are low level. It's cumulative, which means that we may not be able to see those results until maybe months down the line, if you did receive a substantial amount of exposure.
Is it a common thing where you see people that exceed the limit, or is it more uncommon?
Never.
Never.
mean, I've never seen it. Okay?
What do
I've
you
never
mean
seen it.
regarding quality and quality of the radiation?
Because there's primary radiation, which is strong.
Is
There's
it
a
gonna show
secondary.
physical?
Yeah, so it measures like X-rays, gamma rays, different types of alpha and beta particles. So it depends on what the badges are designed for. Okay. All right. So we'll talk about the personnel monitoring device here again in explicit detail here in just a bit. Now, your protective apparel. If you're in the examination room, notice that the minimum requirement is going to be half of that of gonadal shielding. Gonadal shielding protects the gonads from the primary beam. When we are wearing protective apparel, we are protecting ourselves from primary or secondary?
Secondary.
Secondary, because the energies are lower, we don't need as thick a material. 0.25 millimeters of lead or lead equivalent. Lead or lead equivalent. The protective apparel must be hung properly, just like you have there. We put them up in hangers, and we don't toss them around like it was a jacket. Not on the chair, not on the table, not on the floor. Because that material can crack. And if it cracks, unknowingly, and you're using that apron, are you going to be 100% protected? No, so you got the radiation seeping through the cracks of that lead and exposing whatever parts of your body is exposed to that crack. All right, so it must be hung properly. And we do this on a routine basis where we're checking our protective apparel every 6 months or annually, and we'll do a fluoroscopic check under X-ray to see if there are any pits, holes, or any type of cracking in the material. And if it is excessive and we can't salvage it, we'll get rid of it. Now, it's not like any type of, you can't throw lead in trash. Okay, it has to be disposed of in a certain manner. So we actually have to get in touch with some environmental services to dispose of the lead material appropriately. You can't just throw it in the regular, trash can. All right. As we said earlier, all resources, means, devices, and other tools must be exhausted before the patient is held. Guidelines for individuals who are occupationally exposed to radiation. We only hold under only an emergency when all resources have been used and have been failed. This is not done routinely, only in an emergency situation. And if so, you must wear the appropriate shielding devices. You must position yourself, so if you're holding the patient, okay, as a student, are you going to be holding patients?
Heck no.
No, okay? If you're a technologist, you got to position yourself in a way that your body isn't struck by the primary beam. What's the primary beam?
Diagnostic radiation.
The beam coming from where?
X-ray tube.
The X-ray tube, right? That's your primary radiation. Everything else is known as secondary radiation. Okay. The badge must be worn on the collar level. The collar level. And here is the key. Not underneath the apron, You're not going to wear it underneath the apron. You're going to wear it outside of the apron. If it's underneath the apron, what's the problem with that?
It's not being exposed.
Yeah, the lead is attenuating the energy, so it's not going to get any type of reading. So we don't know whether or not you're getting exposed. Now, why collar level?
Your thyroid.
Because your thyroid, what else? And your eyes. Your eyes and your thyroid are very sensitive to radiation. So if your eyes and your thyroid are within the limits, that also means your entire body is within limits of exposure. Make sense?
Mm-hmm.
All right. So you wear this on collar level outside of the apron. All right. And again, we involve the caregiver or the parent if possible. All right. So students are not allowed to hold deliberate exposure of an individual for training or demonstration purposes is strictly forbidden. That's why we've got what we call phantoms and mannequins to do exposures. Now, this is not for training or demonstration purposes. Deliberate. Deliberate, okay? If you have an order to perform an X-ray examination, is that deliberate? No, okay? You have an order to do it. And as a student, you will be performing X-rays on real patients. Okay? First year, no. Second year, yes. All right, so you'll be on the field performing real live X-ray exposures on live patients. Okay, so let's talk about the personnel monitoring devices. As we said, radiation cannot be seen, heard, touched, felt, smelled. Okay? You can't see it, you can't feel it, you can't touch it. This is why we have a monument that's been built for the X-ray martyrs. Those who have dedicated their lives to researching and understanding X-rays, and in doing so, because they didn't have a full understanding of it, many of them died a horrible death. Okay? It was very slow, very painful. Radiation detection devices are necessary to measure these doses, and they're usually accumulated doses. The monitoring devices are only to be worn on the job. Okay, let's talk about the first part there, on the job. If you injured yourself while on the job, okay, as a technologist, I go to the emergency room. I went to the emergency room because I slipped and fell and I hurt my wrist. The doctor wants to order an X-ray on me, a wrist X-ray. So now I get picked up from the emergency department back into the X-ray department, and they want to take an X-ray of my wrist. What am I going to do with my badge?
Take it off.
You need to take your badge off. Okay? The badge is only for work, because if you have this on during your X-ray exposure, your readings are going to get high. And they're going to say, oh, well, your readings are high. Now you can't spend that more time within a radiology environment. Remember, you know what I'm saying? Your readings get skewed. And this is only to detect worker or occupational doses, not personal doses.
Who monitors this device?
Who monitors it? We have what's known as a radiation safety manager. And that's usually your radiologist. Okay, one of the radiologists is going to be the one in charge of looking at all the different doses and making sure that you guys are within your threshold. They get read by whoever issues the badge. There's several companies out there who issues the badges, and they are the ones who analyze the badges and puts together the data. And then at the end of every 3 or 4 months, we get a report. And we do that for our students as well. The moment that the student starts taking X-rays, even with our phantom dummies, they get a badge. Okay, because we want to make sure that they're practicing safe X-rays. Okay. Again, these devices are there to monitor. It is not a shield. It doesn't protect you. Okay, it's only a monitoring device. Okay, types of monitoring devices. Let's talk about the different types. We've got the film badge, the TLD, the pocket dosimeter, and the OSL. Okay, let's talk about these individually in specifics. The film badge. You guys may have a different picture. I've upgraded or downloaded the most recent film badges. Okay, so these are the most recent types of film badges. You guys may have a different picture on your slide, right? Okay. These are special radiation-sensitive film placed in a lightweight plastic holder. Okay, this is the film itself. Okay, that's wrapped by a certain type of covering and then placed in a plastic device, plastic holder. Okay, it's film. Basically, it's film. All right, and what do we know about film? That when film is exposed to ionized radiation, what happens to film? Density, right? So then, at the end of every 3rd or 4 months, okay, our badges are sent to the issuing company. They're going to analyze the density on that film, and based on that density, it'll tell you. See how they're in grays? 0.5, 1, 2, 3, 4, 6. It'll tell you, based on the density of the film, how much exposure that you've been receiving. Okay? So they measure X, gammas, as well as beta particles. So again, we said that the badge is returned in a given period of time. After you're going to wear it for about 3 months. You send it out. It gets analyzed. Each time you're swapping off your badge, you're getting a new one in return. Okay? Because there is no dead time. If you're sending one back, you should have another one to wear immediately. Okay? So they get sent out. We're going to wear the new ones. They are going to be developed, assessed, and accumulated dose record. The problem is that this is actually good. Is that, first of all, it can't be reused because the film has been already exposed, right? You can't reuse it again. But the positive part of this is that because you have something physically, a hard copy in your hand, you can physically file it away. And if you needed to retrieve some more data or some information from it, you just get the film and reanalyze it. Okay, so it forms a permanent record. Sensitive to doses to 10 millirems and 700 millirems. I don't expect you to understand this right now. But what it's saying here is that it's not very sensitive at all. And you'll see that as we progress to the other types of badges, that the numbers become less and less and less and less because they're really, really sensitive. These are sensitive to high doses. I mean, very, very low doses that are considered high in units. All right, so the rugged and inexpensive, it does form a permanent record. What did I put here? Accuracy? I think it confused people when I said accuracy. So put it down to error. Okay? So that it has a plus to minus 25% in error. Which means it's only what? 75% accurate. Okay? It is inaccurate because it's sensitive to heat. It's sensitive to
Electricity, maybe?
I don't know about electricity, but it's mostly sensitive to like different changes in the atmospheric pressure. So pressure changes and heat. And this was one that they assigned to us when I was a student over, I don't know, a long time ago. They gave us film badges. And I was always constantly conscious about where my badge was. And I sometimes got excessive readings, like borderline excessive readings. And what they wanted to know is why was I getting those readings and why there were other people in the department that were getting excessive readings. Okay, because we were practicing good radiation protection, but we were still getting excessive readings. So we were kind of watching the behavioral patterns of all the techs in the department, and they had found out that, you know, our processor, while we're waiting for films to come out, there may be like 2 or 3 of us hanging by the processor waiting for our films to come out, and what we'd like to do is we'd like to lean up against it.
Produces heat?
Yeah. So what it was doing was picking up the heat off the processor. So we were just casually talking, hey, how was your weekend? What'd you do this weekend? You know? So that's what happened, all right? Very sensitive to heat. If you left it in your car, If you left it in your clothing and it got washed and went into the dryer,
You're dead.
that happens too. Yeah. So again, we'll put you on temporary leave, reassign you, until we find out exactly the cause of those excessive readings. Okay? But we've never got an excessive reading due to radiation exposure. I mean, from my experience. I'm not saying it's never happened. It has happened, but not under my watch. All right, so we wear the badges on collar level. By the thyroid, by the eyes. Here's an example where there's one worn in the belly level. But look, it's underneath the apron. Now, why would you do that? For who? Pregnant technologists. Pregnant technologists. So we can also measure the amount of radiation that the embryo fetus is receiving. But why underneath the lead? Why not outside? Because we want to see if there's any radiation
Because the
going
lead's supposed to
through
be
the
protecting the
lead.
baby,
Right,
right?
right. Because it's not 100% proof. The apron is not 100% proof. Okay? So there may be some radiation going through the apron, and now we can measure it. But even then, the amount of radiation that the embryo fetus is receiving is going to be even substantially low, because you've got your lead apron, you've got your tissues and organs and adipose tissue and all that protecting the embryo fetus, right? So the mom's probably going to get more radiation than the child itself. Okay?
What about the back of apron? Because the back is open.
Exactly. The aprons are designed typically for the type of work that you do. Okay? Most of the time you're facing your patient and you're facing the x-ray tube, so you're protecting your front. You never turn your back on the source. Okay? You never turn your back on your source. These are designed for x-rays, basic x-rays, single shot x-rays. Now, if you're working in special procedures or the cardiac cath lab, where the exposure is constant and live, what I wear is I wear a vest and a kilt. So it's a full wrap vest, and it's also a skirt, a kilt that I wear. So that way, even while the x-ray tube is going, I can turn my back and do the things that I need to do without exposing myself. And they're designed differently because of also weight. The more protection you have, the more heavier it is. All right, so we try to minimize it as much as possible because it does weigh a lot, and it can, it can hurt. You can hurt yourself from all that weight. Good question. All right, any questions here? Okay, so this wouldn't be used like in a high production type of radiology department. These are good for like dental offices and clinics where you're not getting a lot of X-ray exposure. Okay. Next one here is the TLD, or the Thermoluminescent Dosimeter. Within the hermetically sealed plastic casing, what does it mean by hermetically sealed? Hermetically sealed is that it protects from the outside elements, right? It protects from the outside elements so nothing can leak in. Hermetically sealed is like when you go to Costco or Target and you buy something in a plastic wrap, and you need scissors to open up the wrap just to get the contents out, and you're cutting yourself trying to get the contents out.
It's like vacuum sealed almost?
It's
or?
vacuum sealed, but it's also like the plastic is melted together, hermetically sealed. This is what it is. Have you guys ever, one time I bought myself a pair of scissors in one of those plastic seals.
You need scissors to get them
Yeah,
out.
you need scissors to get them out. All right, so hermetically sealed. Contents is lithium fluoride crystals. Okay, they respond or react to the ionizing radiation. This concept is going to be very similar to some of the concepts we talked about earlier with film emulsion and the intensifying screens and the photostimulable phosphor screens in your computerized radiography. The concept is very much the same. So when the crystals and these casings are exposed to radiation, they store that energy until they are later released. In this case, after 3, 4, 6 months, the badges get sent to the issuing company. These badges, or the contents of the badges, the crystals, are then put in a heated container, and as they're being heated, they're going to release some light. This sounding familiar to you
Like
guys?
the PSP, right?
Huh?
It's almost like how
It's kind of like a PSP, right? So it goes into a heat container, light is released, and the amount of light that is released is proportional to the amount of radiation it absorbed. Okay? So the more light released, the more exposure. The less light released, the less exposure. The least amount of exposure. These are ideal for nuclear medicine. Look, now it's getting smaller and smaller. It's getting more and more sensitive, even at smaller doses now. It's ideal for nuclear medicine because we have the capability of using them in different forms, not just a badge, but we can use them for the wrist and also the fingers, because nuclear medicine techs are handling radioactive pharmaceuticals, right? So it's their hands that are constantly being exposed to radiation. So we're going to measure that. Nearly accurate, plus or 9% in error, right? So it's about
91%.
91% accurate, okay? Has a wide range of readings, it is reusable, and it's not heat sensitive, so that's a great plus. However, they are expensive. Once they're read, can't read them again. Okay? And they do increase in sensitivity with use, so at some time, we got to start off with a new set of crystals to measure our exposure. Any questions with the TLD? Lithium fluoride. Lithium fluoride. Okay. Pocket ionization chambers, or PICs. They're also known as your DRD, or direct reader pocket dosimeter. As the title says, as the name says, it is a direct reader. These are pen-size type of Geiger machines, like you're talking about. Okay, you wear in your pocket. And I can take it out of my pocket and get a reading immediately. I get immediate readings. I get direct readings. These are especially important when you're working in facilities such as in a nuclear plant or some kind of industrial environment where there is radiation all around you. So we need to measure the amount of radiation right there and then. It's the best type of protection because you can look at it and you can see whether or not you're still within threshold or you're approaching threshold and you need to take yourself out of the environment. Okay? Now, with that said, you cannot use the PIC exclusively, which means you have to use it with another measuring device. Because although this is live, we also want to be able to know your accumulative dose, 2 weeks, 3 weeks, 4 weeks, a month, 2 months, 3 months, you know what I'm saying, right? We need to know your cumulative dose. These aren't permanent record because each time you have to use this, you have to zero it and recalibrate it. So once you get it back into recalibration or zero, you lose your reading. That is why we also need one that'll measure the amount of your radiation that you've been receiving up to that point. Okay? So ideal for high radiation areas. Remember the definition for high radiation area? Any area in which you can receive 100 millirams or more in a given hour. Remember that? 100 millirams or more in a given hour. All right, see it's getting smaller and smaller. We're getting more and more sensitive. So the positives are you get immediate readings, reasonably accurate, reusable, and small in size. However, once you read it, you lose your record. You have to constantly calibrate it. And it's also susceptible to mechanical shock. So if it gets bumped, if you drop it, you lose your readings. Okay? Any questions here? All right. The OSL is the optically stimulated luminescent dosimeter. Optically stimulated luminescent dosimeter, OSL. Within the hermetically sealed packaging is aluminum oxide. It's aluminum oxide. Again, listen to the concept. It gets exposed to radiation. It's going to store the X-ray energy until later released. These get sent back. This is what actually I have. This is an OSL. The one I have is an OSL. The ones we give our students are OSLs. Okay, so the crystals receive radiation. It's going to store the energy. At the end of 3-4 months, the badges get sent to the issuing company to be analyzed. The crystals are going to be scanned or exposed to what color light here? Green light. Okay? And the crystals are going to emit a blue light that is proportional to the amount of radiation it was exposed to. The more light, the more exposure. The less light, the least exposure. Okay? Like your PSPs. Look at this. Sensitive to as low as 1 millirem. Very, very, very sensitive, and it's also very discriminant. It discriminates from high quality radiation and low quality radiation. Those that are only pertinent to our type of exposure. 1% error.